All right, everybody, here we are. Mr. Crook here with Anatomy Physiology. We're going to go over Unit 4 project. This project dives into a urinalysis test, and I think it's pretty interesting, and it goes through some high-level thinking on your end. So anyways, just to get started, I wanted to go briefly over just to walk you through. So when you get to this project, there's actually going to be a urinalysis test that you will analyze. And so right here is this urinalysis test. The question we have to look at is, what do each of these numbers mean, and how do we identify the issues here that we could then go on and describe to the patient. And so you are going to act as a physician in this case, and you will look at this data that was then just gathered from their urine, and you will write a letter to the patient indicating your concerns about the report and maybe just stating the facts that you receive. Okay, so you can see right here there's some data that they receive. Sorry. SG, this would be gravity, and how they get this value right here is just strictly they compare your urine density with water. Okay, and if it's very, very dense, then we know that the kidneys are not doing their proper job. They're not retaining, or they're not diluting your urine well enough, or it could indicate that you are dehydrated and you're not drinking enough water. And so that's one thing there. And so this is a little bit more than one, but it still is in the threshold, and I'll show you that threshold. Then we have proteins, glucose, ketones, bilirubin, blood, nitrates, sodium, and potassium. So when we look at this, we can see right here what each of these values mean. Okay, and so we can see right there the specific gravity. If it's 1.01 or less, then we're probably okay, and dehydration is not a concern, nor is that your kidney isn't diluting the water or your urine well enough. All these other ones will be most of them will be a negative value. And so you want to look and see, was there a positive value in that? And so when we're looking at the protein, for example, a normal value would be a negative, but sometimes, so let's say you get a positive, well, what does that even mean? And so it's shown right here. And so the problem, let's see, can I get a pointer? Yes, I can. Okay, so there must be a problem with the glomerulus that are allowing proteins through. Okay, so that'd be an indication there of that. If we need to, make sure you review on what the glomerulus is. Glucose, this could be diabetes right there, or just too much sugar. Ketones, these are fats that are being metabolized. That could indicate that they're being metabolized at a higher rate. Maybe there's low blood sugar, or you have a chance for diabetes. Bilirubin, this one's kind of interesting, but it is part of the your blood. Jaundice is actually could cause this, hepatitis, or cirrhosis is another one. Okay, I don't know if I said that right. Cirrhosis. I'd have to research that one. I've actually never seen this. But anyways, hepatitis and jaundice would be an indication of that. Again, for blood, this would be very bad. If there's blood in your urine, you call the doctor immediately. Okay, that is meaning that you're bleeding in the kidneys, and you need to go see somebody about that. Nitrates, again, negative. If so, you have a urinary tract infection. Sodium, we would want in this threshold of 150 to 30 or to 300 millimoles, and that's actually, if it's outside of that threshold, it's showing that you might have some kidney failure there, and this is actually probably a start into dialysis and other things that might have to happen. Okay, the same thing for potassium would also show kidney failure. All right, so let's look at this value again. Let's just put these side by side here. And so again, we have as a physician, you receive this value. these values for each one of these. And so looking at the specific gravity, it's 1.01. So now if we look at that value, and actually what I'm going to do is let's just copy this and stick it so we can look at it right next to each other. Let's make it a little bit smaller there. There we go. Okay. So when we're looking at this, let's just take a look and see what we can do, what we can understand here. So our, I'm just going to make some statements here. So what I would like you guys to do really fast is just pause, and I want you guys to try and come up with your own conclusion. And then I will go over some of these with you guys. Okay, so pause, and if you've got it figured out, then you can push play again. So the specific gravity, 1.014. So it is slightly bigger, but not by much. Okay, so I would probably, if it was me, if I was a physician, I would call them and say, hey, you had urine that's maybe showing that you are a little dehydrated. Make sure that you drink the proper amount of water each day. Okay, that'd be one thing that I would state for the specific gravity test. Okay, because it is right there on that threshold of being too high. And so I would definitely state to them that maybe they just need to drink some more water, see if we can get that back down, and come back in 6 months and we'll retest, right? Proteins, they got a negative value, so we're good there. However, in glucose and ketones, they got a positive value. So glucose and ketones got both a positive. So because of that, you guys, I want you to think about what that could maybe implicate and state. Is there a commonality between those? Okay. In the blood and bilirubin, they got negative values, so we're good there. Okay. And so then in the nitrates, this is interesting to me. They got a positive value. And so obviously they have a little bit of a urinary tract infection. And I'm wondering, could that affect this? Okay. And then sodium, they had 160. So it's again inside of that threshold. So we're okay. So thank goodness there is no acute kidney failure. And again, potassium, same thing within that threshold. However, it is slightly high. And so, but again, we don't know the effects that maybe the bacteria in the urinary tract could have caused there. But again, looking at these two things that were positive, the glucose and the ketones, is a big indicator to me that there's probably some diabetes going on, too much sugar in the blood, and because of that, that they could be using fats to metabolize and to take care of that. Okay, and so, anyways, I would definitely, if it was me, write a letter to this patient stating, number one, make sure you drink plenty of water, and let's make sure that get you tested for diabetes. And so, anyways, what you're going to do for this lab is you will write a letter to this patient. You guys make sure this letter is specific, to the point, and based on evidence. Okay, and so you have the evidence here, and so make those connections. And when you're writing that, you'll submit that to me. It needs to be about a paragraph or two long for you stating the information there. Remember, your patient does not have much information about a urinalysis test, urinalysis test, and what these values mean. And so make sure that you don't just strictly say, yeah, we tested and you got a glucose and ketones where it came back positive, and so that's not good. All right, be specific there and let them know, what does that mean. Okay. Anyways, if you have any questions, please let me know. And hopefully this video is kind of a help to get you started in brainstorming using this urinalysis test.